To move on to the topic Life After Cancer, the unspoken journey of survivorship. What generally happens actually when we talk about survivorship? We always think that survivorship means completion of treatment, after treatment life, and then somebody who has completed treatment in remission, then loved one, friends, everyone comes and they say, oh, move on, forget about that chapter, it's new life, don't worry. So that's it. So probably we need a lot of awareness about survivorship issues and also understanding and compassion towards survivors who are struggling this battle. So what is survivorship? It begins in all the definition, the recent definition. There's a lot of changes and adaptations are happening in this definition, but this recent definitions are saying that it begins at the time of diagnosis. It includes people who continue to have treatment to reduce the risk of recurrence. So treatment of cancer, but at the same time treatment of late effect after the completion of treatment and managing chronic disease. Cancer survivorship encompasses the physical, psychological and economic aspects. People living with cancer. NCI has broader explanation that cancer survivorship is complex, like we are discussing, it's so unpredictable disease, and that's why many times we don't know how to move on with the problems. So it says that includes the perspectives, needs, health, and not just physical health, but emotional, psychological, spiritual, economic challenges experienced by people and caregivers. So very briefly about the background, that when we know it starts from the beginning, from the diagnosis. And now when the modalities have so much advanced, then more people are living with cancer. So majority of them are in survivorship profile. More survivors and caregivers often experience all these multidimensional issues, which Sir and Dr. Joita has actually made my job a little easier, so I can bear with this talking. And so these issues affect quality of life, mental health, family dynamics, relationship, and very important is social reintegration. Why it is important? Because as we say, the incidences are rising. There are more people surviving with these advanced modalities. But the needs, which are so complicated, multidimensional, are often unrecognized and underserved. Underserved because there are many reasons. Workload, more time, whatever we can say. And we have to remember, in India, more number of young survivors are in survivorship profile compared to Western world. So this is something we really need to understand when we plan to work with this population. This continuum has already been explained. So these are the phases. This is the journey of a cancer survivor from all these phases. And we can see from the diagnosis till the end, whether it is survivorship or end of life, psychosocial support and comforting, compassionate care is always important. And throughout the trajectory, targeted navigation, need-based navigation is important to assess their needs. And distress screening is also important at every point. So you can see this cartoon here, we can see the intricacy of this multi-dimensions. There are so many issues, but they are so intricate. Physical is affecting mental, mental issues affecting physical, social issues are affecting mental. So that's why, Sir has already explained that many times it becomes difficult to assess. It is because of what is happening. And using our judgment and experience is very important at this time, and not the literature all the time, or not the books all the time, and not the Western literature all the time, because our population, our experience, our culture definitely is different. In oncology, when we talk about survivorship, the population is divided, the whole age spectrum is divided into 4 different groups: pediatric, adolescents and young adult and geriatric. So this AY, adolescents and young adult, you can see 15 to 39, and adult. This population quite in majority, but when we assess the impact, the pediatric population, where they're dependent on their parents and the whole decision making process is left with their parents. So there's a lot of caregiver burden, but at the same time there's disruption of schooling, play, peer relations. Ultimately, in long-term survivorship, how does it impact? How does the child grow up, and what are the difficulties? We can just imagine that, because the whole developmental process is disrupted. AYS, these years are identity formation years, but the education, career, relationship, romantic relationship, everything is disrupted because of cancer. So the concerns are more like body image, sexuality, fertility, fear of cancer recurrence. All this has already been explained, but age appropriately we can see the financial toxicity is also perceived by young adults and adolescents, because they are in the age where they feel the responsibility, they feel that they want to do something for their family. Impact in adolescent, in adult population, they carry multiple roles, so role strain is there. The parenting, employment, caregiving for elders like their parents or in-laws, everything is disrupted. So there is caregiver burden. Being patient, there is caregiver burden. And financial burden. The relationship stress, sexual problems and concerns are there. But in this age group, earning, livelihood is major responsibility for any person. So planning for return to work is the prime concern, even for oncologists. And now the what we can say, the perspective has changed for even oncologists and clinicians, and the perspective is more holistic. We'll talk about it later. In geriatric population, there are already comorbidities. So this functional decline, loss of independence, cognitive issues, and caregiver exhaustion, because caregiver is always required at every point. And the priorities of treatment is different, because here the priority is quality of life and not to extend the life or longevity of life. So throughout all these age spectrums, psychological distress is common phenomena. But fear of recurrence, which is inducing anxiety, hypervigilance to bodily symptoms. So you have completed the treatment, but still any small symptom is alarming. Oh God, not again. फिर से जाना पड़ेगा. Oh, I don't want to do this again. So there is avoidance of your appointments, doing the procedures. I don't want to do it because मुझे और कोई bad news नहीं चाहिए. So this is commonly seen in long-term survivors. Depression, anxiety is due to uncertainty. What will happen next? I'm cured, but I'm not sure how much life I have. I have changed as a person. I'm Savita Goswami, but now when I go out, you say, oh, उनको cancer हुआ था, पता है. So the person, what you were before, is not, the identity is not the same. And it hampers everything, your social image, your professions, your work life, and sometimes also your personal life. Post-traumatic stress symptoms, so then those intrusive thoughts, hyperarousal, and again avoidance of the कैंसर एक्सपीरियंस. जैसे सर ने कहा कि नो, वो सीरियल में भी कैंसर का कैरेक्टर कोई है तो मुझे नहीं देखना है वो सीरियल, मुझे कैंसर वर्ड ही नहीं सुनना है. आई डोंट वांट टू लिसन एनीथिंग रिलेटेड टू कैंसर. It is that level of avoidance. And this can lead to maladaptive coping like substance use, risk taking behavior. And when we are dealing with survivor, we really have to be aware of all these coping strategies and we really have to work and assess them seriously. It has been explored and talked, excuse me, body image phenomena, disfigurement and psychological well-being quite well associated. We know about it. But literature has said that at least give some time, give more information about it. Only then it is easier to accept. There will be trauma, but it will be easier to. But cancer treatment always needs urgent interventions, and then there is lack of time. Mastectomy, amputation, there's hardly any time to make decision, prepare the patient, and then there is the long living trauma which they find to the recovery process is difficult. The time since diagnosis, 4 साल हो, 6 साल हो, there will be always that trauma related to body image. भूलेंगे भी कैसे? रास्ते पे जाएंगे तो people will stare at you, people will ask you ये क्या हुआ, वो क्या हुआ. So that inclusiveness, that acceptance societally at personal level, many times it's lacking. And it's the person himself or herself. The way they perceive the whole trauma, that also matters. How you accept it, how you accept yourself. And that is how low self-esteem. So disfigurement always lead to lack of confidence and low self-esteem. A person who is so confident now, not even going out of the house. The cancer types, which have obvious or visible disfigurement like retinoblastoma, breast cancer, then head and neck cancer, is directly, the anxiety, depression, dissatisfaction is quite obvious or very common in these survivors. We talk about, advancement, but still people have misconception. When survivors come back for their review appointments, they tell that people are looking at them like an alien. They are not invited to social gathering, and families are abandoned. So we are still living in this type of society. There is discrimination. A very young boy was referred to me. I work in a childhood cancer survivorship clinic, and this clinic is there since 1992. Well-established survivorship practice here. And I am there since last 30 years. So this child was saying that, ma'am, मुझे स्कूल जाना बहुत पसंद है, पर मुझे बहुत दुख होता है. So I said, what happened? No, when I go to the school, I am not allowed to sit on the benches. I'm told to sit out at the floor and सब बच्चों के दूर रहना है. My teacher is not touching my books, and I am always being teased, and I'm fun and bullied by other peers. So tell me, how would be the experience of this child? So how he will feel like studying, educating himself? So all these hidden sufferings, probably we don't know about them. Marital strength. Many of our young survivors, they were very young when we started in this clinic. Now they are grown up, they are having their partners, but they are scared to talk about their cancer history because they are not sure whether they will be accepted or not. So these kind of issues are there. And we are aware that cancer treatment hampers sexuality, fertility. So a young boy, he was very young at the time of treatment at age of 3, 5. And now he knows that he has a zoospermia, zero sperm count. What kind of, trauma he must be going through? Though the treatment has completed long back, 15 years ago. So these are the difficulties, and along with the CNS radiation, high-dose chemotherapy, there's cognitive deficits, there's also psychosocial issues of self-acceptance can hamper their work and education. Cognitive and neurological issues are well known. Attention and concentration issues, memory problem, impaired executive functioning, slow processing speed and fatigue. So people are not able to work. After cancer treatment, when they want to work, they want to go to the school, they are not able to sustain with the routine, they are not able to concentrate. If they want to work 9 to 5, they don't have the energy. But do we have the provision? Does anybody is aware what kind of problems they have? So that inclusivity in the system is still not there, and that should be another intervention for maybe for the whole system. Spiritual distress, sir will talk about it, but we have to understand this distress where after this big trauma where your belief system, values are challenged and they are shattered, that I never thought a person like me, never done anything wrong, I got cancer. And I never thought it before कि मेरे साथ कुछ बुरा हो सकता है. And that has taken away all my faith. कि क्यों भरोसा करें हम भगवान पे? And I'm worried. I feel this all those bad people are happy, and why me? So this creates a lot of hopelessness, a lot of despair, and loss of meaning. That then there is no point in living, and also this uncertainty. So जी के भी क्या करेंगे, पता नहीं कल क्या होने वाला है. So why to do all this struggle? So this impacts on survivorship because spiritual distress can lead to heightened psychological distress and lower quality of life. It impacts treatment adherence. So many of our survivors, they are not coming to their routine follow-up just because they think, why to spend so much on me? I don't know, ये side effects हो सकता है, वो side effects. I have to do so many, late effect checkings and investigation. So that means I'm still not better. I'm still not recovered. So this is disheartening for them, and this can impact on their meaning in life. But on the other side, spiritual well-being and meaning making predict better emotional recovery and resilience. So that means these interventions, meaning making interventions, have lot of scope in survivorship. So caregiver burden, caregiver is the biggest pillar of oncology care. Without caregivers, no patient can take treatment in oncology setting. So we really have to address their emotional burden. When the survivor perceiving all that anxiety, fear, that is always mirrored by the caregivers. They do experience the similar intensity of anxiety and fear. The guilt, hopelessness, anticipatory grief, because they are seeing the suffering of the patient. So for a mother, if the child is treated, but still that child is not able to live normal life, is quite a bit of a trauma. And they go through that, and that can lead to long-term stress and burnout. So this role strain many times takes away their identity. So caregiver's identity becomes secondary. Their self-care, their socialization is not important. That much of absorption happens with this caregiver. And this can impact again, lot of distress. And who addresses that? Who talks about it? So in Tata Memorial Hospital, in Psycho-Oncology department, we are open to all the referrals. So we get so many caregiver referrals, of caregiver burden, and we do the equal intensity interventions for caregivers. And I would like to mention here that in hospital, we run 4 support groups in a month. One for adolescents and young adult, one for the adult group who is coming for their psychological issues, one daily support group. So we go to different OPDs and do education about mental health and importance of psycho-oncology, and one support group which is a monthly support group for all the patients, caregivers where they come, and we talk about importance of every aspect which caregiver and the survivor should know. So therefore, why survivorship deserves dedicated attention? Because it's a long span. Because People may suffer in silence. They may not talk because probably they don't have resources, probably they may not have somebody to talk about it, somebody who will not give time to them. So, and they know how to deal with it. They don't know how to deal with it. And if this is untreated, then that will affect many of other issues. The care is fragmented when they are away from hospital. When they are hospitalized, everything there available, the rehabilitation, psychiatry and everything. But when they go back in long-term survivorship near their home, the services are not available under the roof. And they have to run around. They don't have this time, they don't have this energy. Parents have to focus on their other roles. So many times the care is fragmented. And the hope and the growth to sustain life needs nurturing, needs time. That requires. And that is why I think specialized survivorship care clinics are important. So in Tata Hospital, this clinic is there since long. The adult survivorship is still, not so systematic, but they follow the similar principles. The similar OPD happens, but all the long-term survivors are ticked for all these criteria, and the referrals are made to appropriate as per appropriate need. So this is multidisciplinary. So there is oncologist, there is psychologist, there is medical social worker, and all the rehabs where they are referred as per the requirement. Medical surveillance of recurrent secondary cancers, because there is a risk of secondary cancers and late effects. That is done. Symptom control and rehabilitation, psychosocial care like screening, counseling, peer support. At timely support is given. Along with that, need-based social, financial and vocational support is also given. The hospital is going out of their purview and they are providing care. Like these survivors, young survivors are provided with vocational training. They are provided with additional guidance for their future career. They are supported and given scholarship for their studies. So all this has been taken up, and this extension of services is there for survivorship. So this care coordination needs written plan so that everyone knows what is expected from them. Sorry. But the key challenges are all the logistic issues, Once they go back, the cost, out-of-pocket expenditure, their responsibility. Sometimes lack of awareness is also responsible for that. Socio-cultural factors, we were talking about stigma, we were talking about secrecy. So one of our survivors' parents were saying, then they didn't come for 4 years, and then they say कि नहीं आते हैं मैम, अभी तकलीफ हुई इसलिए आना ही पड़ा. But why don't you come? नहीं आते हैं तो लोगों को लगता है अभी भी ठीक नहीं हुआ है. We don't want people to talk about it because आगे चल के इसके फ्यूचर का सवाल है, इसकी शादी करनी है. So remember how long it goes. It's not just cancer and not just illness. So it is impacting whole life, and not just that person's life but the family life. So limited survivorship clinic, that is one of the lacunae, but now many NGOs have come forward and setting up different clinics. Indian Cancer Society has taken up this, and they have forming new clinics in different hospitals and creating a follow-up pathway. So this model, which is already talked about, is very, very useful in survivorship. As per NCCN guidelines, periodic screening for distress, fear of recurrence, long-term side effects and lifestyle management is very important, and we do practice that in our clinic. But for long-term support, what is required? Holistic support, not just physical, not just oncology, but holistic support, personalized care plan, because each person's issues are different and situation is different. Routine screening, lifestyle changes, and very important is integrated care. So intervention is not required only for family, and it is not just about teaching doctors and nurses, but it should be taught to the whole community. The GPs should be trained, the school teachers and even the peers should be trained what is cancer and what is the side effects and problems of cancer survivors. Psychosocial support in survivorship. There are many evidence-based psychotherapies can be practiced and it has shown good efficacy. CBT, acceptance and commitment therapy, mindfulness, psychoeducation. But all these again we have to tailor-made because CBT 8 session, 12 session in a oncology setting when patient is coming for follow-up, it is not possible. But cognitive therapy based approach we have to accept and deliver. Psychoeducation is very important at every point because we have to educate them for everything. And that is how we can spread awareness. What is most important is peer support group. Because there they learn from each other, from each other's experiences. Like Sir was saying, how do I answer? Sometimes we don't have answers. But they listen to the other's story and they get their answers. We don't have to explain. They learn from others' experiences. And that is, I think, biggest support for them, which gives them belongingness, that they are not alone in this whole journey. Digital interventions are also now helpful for educating them through webinars, through some lectures, we can educate them. These are some psychological interventions specifically for this young age people because we have to target them. And social support, hope, quality of life, psychosocial support has shown that there is post-traumatic growth and meaning in life through these interventions. And there is enhancement of social interaction, communication, and self-esteem, confidence, and physical activity and mobile-based interventions have also shown physical and psychological well-being enhancement. Psychotherapy, psychopharmacotherapy is very important, and we heard about this from Sir and Dr. Joita, that there's a lot of scope for psychopharmacotherapy. These survivors, when they go back, they definitely have the whole spectrum of different disorders, and this could be due to anything. This could be due to late effects, this could be due to just new onset, but they need detailed evaluation and appropriate management. Integrative therapy, something like adventure therapy, art therapy, expressive art therapies. I believe so much into this when it comes to survivorship, because I have seen while working in this survivorship clinic that I have practiced all these therapies, and this has really enhanced self-esteem, autonomy, coping, awareness to self, communication skills. So which are these activities like camps, nature trails, drawing, painting, art activity basically, and expressive therapies like role play, drama, storytelling, music, and different workshops. And here you can see that we practice all these with our survivors. They have their annual programs, they do awareness programs, they come and sit and counsel other survivors in survivorship clinic. So here there's drama, there's dance, nature trail. If you see this group picture of nature trail, few of the survivors could not make it and they are not with us, but they have lived their life with meaning with all these, the group of people where they found some meaning. And this is the art which is done by one of the survivors, which says life is hard and some days will feel impossible, but remember why you have started. So healing doesn't end with treatment, it's continuous with every step forward. Reintegration is deeply personal, so we cannot just generalize it, but a holistic, compassionate approach is a key to thriving after surviving. This is a picture of hope and peace. So on this note, I would like to thank you. And this is also an artwork done by one of our survivor. Thank you so much.
So much, Dr. Savita, for telling us all the dimensions in which cancer impacts and that it's a lifetime disease. And you have also emphasized on the need for peer support and support groups. So listening to other people suffering from similar disorders is probably the best way to bond and go through the difficulties of life. Questions, please. Yes, sir.
You have cited subjective experiences. I draw your attention to the Journal of Oncology Navigation Survivorship of December 23, volume 14, number 12. The title is The Most Beautiful Sound. Just Google it, the most beautiful sound. It's the research which says there is a sound researchers want your patients to hear. The sound of cancer cells being destroyed. I know this because my son was involved. And he's duly. There is a way by which the patients can hear the cancer cells dying with treatment. This was tried at the American oncology conferences, and the patients' reviews are all there. I am not here to praise my son. I am here to say that the most beautiful sound is an objective parameter to convince the patient that what is cancer? Cancer is simple. Any cell that is born should die. When it doesn't die, it becomes cancer. So you kill it. And you kill it with various things. But with chemotherapy, when the cancer is treated with drugs, cancer cells die and they make a sound whilst dying, which the patients can hear. Journal of Oncology Navigation Survivorship, December 23, volume 14, number 12. It's on Google.
Thank you.
Since you have acting and media background, can you prepare any role plays or script plays on individual basis for cancer education?
Yes, sir. So with the survivors support group, we had monthly support group meeting. There we always had role plays, about their situation, like somebody who has lack of confidence, somebody who has social discrimination. So we have done role plays, and through that we have done education, like how one person feels and how one person should react to that, even communication skills for this people. And these role plays are recorded, and these recorded role plays are shown to other survivors also. And there are many points when I have interacted with media. We have always said, this participation to support group and these activities are important. So even some of this material is also there on the website. You can see that, because we had an annual meeting in which we had panel discussion, we had role plays, small skits, small dramas, and through that we educate survivors, parents. Yes.
Vaya's son is in America and he is doing very, very advanced research. Probably here it is not very practical to make these cancer cells talk to.
Sir, this is my younger son.
Yeah.
He is a PhD in molecular biology. And he got what is known as Golden Lion Award at the Canes for this research.
Yes.
It's at this point in time not individualized. It's a generic sound, which he is now left grey, joint, Accenture this, but it's being worked for individual patients. So
Yes.
it's apparently not very difficult. It just requires a lot of patience to do it. It took 3 years to get, and then eventually got the Golden Lion Award for it.
Very good. I had one patient, 12-year-old boy, and he had a sarcoma of the leg. And parents were told, the boy was not told about the operation. And this even I knew first time, such an operation is done. And when the leg was cut, the lower part of the leg was again connected with a foot in a reverse manner. It was connected for the prosthesis.
Rotation
An
plastic.
artificial joint was created, and the boy was not told anything about it. And after the operation, he said that this operation is wrongly done. Why my leg is reversed, foot is reversed? And then he constantly was crying, and that was the time I was called. Probably parents had decided and agreed to the surgeon, but surgeon had never told the boy. But after seeing his post-operative state, he was in a shock. Intelligent boy. So probably counseling starts even before the operation, and the intelligent children can understand it. Thank you. It was
Yes.
very well presented.
Thank you.
Thank
sir.
you very much.
Thank you very much. Thank you.
Any other comments? Questions? Experiences?
I am asking this question because I feel I am little conservative and orthodox. What some people get married to cancer survivors, and do you have to convince their parents to accept this match?
So we have such couples where people have married to cancer survivors, and from our survivorship clinic we tell all the young survivors who want to marry, planning to marry, that any time when they feel that they want to convince the other party that how is their condition now and what is this survivorship means, then all the doctors and whole team is ready to talk to them. And we have done this before. This is one of the area which is very important, because otherwise these children will not get rehabilitated to mainstream. So we are doing everything possible. We are also talking to their partners. They are coming with their partners. They ask all the questions about fertility, about having normal child. Do my child also will get cancer? All such questions are coming up. So oncologists, psychologists, social workers sitting together and they talk about this. One time, few years back, one survivor, he was about to marry tomorrow. It was love marriage. And he calls me in the evening, one day prior, that ma'am, अभी वो बोल रही है कि I'm confused. I don't know whether I should marry you or not. What should I do? Is she ready to talk to me? And then she spoke to me. She said, ma'am, I have come to the clinic, but still, this is the time where I'm again tense. So she spoke to me. Now they are married, happily married. Yes.
He married to keep her happy before the death.
Is there a regular support group which runs like once a week at a specific time where we can refer patients who come to us? Because we also don't have proper knowledge, and if somebody is holding a group on a regular frequency, then they can be referred or something will be done about it.
There are support groups, but they are only for registered patients, like those who are Tata Memorial, taking treatment in the hospital, or survivors from Tata Hospital.
But maybe they can be referred to Indian Cancer
Society, yes, that can be possible.
Cancer Society runs their support group, so they can be referred to that. So that will be
And if you have a psychologist and if you want to establish your own support group, we can help you in that.
Have you seen relatives of a cancer patient marrying a cancer survivor?
Yes, we have seen.
How often and how successful?
Rare cases come across. We don't know otherwise. Those who come to us, we get to know. But it was successful marriage.
And it's not always success. We have two survivors marrying each other, and that didn't really work out. So we can't always share success stories.
No,
Yeah,
relative of
no.
a cancer survivor,
No,
marrying a cancer survivor,
Huh.
they have the empathy.
No, see, it is about marrying. Then marriage being successful or not, that for everyone, it is the similar case otherwise. But having that attitude of marrying survivor is, I think, important. Then success of marriage, I think we cannot talk about that.
There has been a shift in the last so many years. In the last 20 years, we would get this family saying we don't want to tell the other party about that.
Yes.
But now there has been a shift where they will say, yes, we will discuss, and yes, we will, can we come to you if anybody else? So that I guess that's because of, more openness, more this thing. But
Yeah.
there has really been a shift from before.
And we see that young survivors, they really don't want to hide anything. But there is parental pressure that don't tell. So there is a dilemma. So we have also, usse bhi rasta nikalna zaruri hai, some middle way. So we tell them that anyway you meet the girl or boy, this is between you and him or her. Tell her that अगर आपको मंजूर है तो शादी करो, नहीं तो मत करो. Just don't tell anyone that I have shared this with you. And 2 survivors have done this. One, the partner has agreed to marry. One refused.
I have a question. I want to ask, is there a difference between the quality of survivorship depending on what socio-economic background a person comes from?
See, there is the additional distress is then limited, like finances and other things, And if the financial strata is little better, then acceptance and education of that community, I suppose, will be little better if not. But people at least agree to that, they can talk to people. Where in villages, in lower communities, they just can't even utter the word cancer. If people are staying in cities, there is some amount of acceptance. People will still have some apprehension. Some people will be still talk about it. But yes, the resources makes lot of difference, that otherwise other children, they don't even get resources to study. If their parents are spending much on their treatment, then they spend for other child to education. They will not again spend for this child because इसको तो anyway बार-बार hospital जाना पड़ता है, वैसे भी पढ़ाई कहाँ होने वाला है. So they try and educate other child, and this is how the economic adjustment is. So this way the distress is little less, but not otherwise. The psychological distress, I think there's no difference. It's only materialistic or I think economic.
Lot of celebrities come out openly tell about this. Manisha Koirala.
Yes. It helps, when people talk about it, it helps. And therefore, in our support groups, we empower people to talk about it. We'll tell them that when you go back to your hometown, tell that there are so many people surviving with cancer. Everyone doesn't die with cancer. क्योंकि अभी भी लोगों को लगता है cancer means death. Tata hospital means Tata to your life. ऐसा भी लोग सोचते थे पहले. Yes, sir.
The ChatGPT says, I asked ChatGPT, is it safe to marry a cancer survivor? So it says it can be completely safe and fulfilling to marry a cancer survivor. Having had cancer does not make someone unsafe or unsuitable for marriage. What matters is understanding a few practical and emotional aspects, just as with any long-term relationship.
Correct.
Here is a clear, balanced way to think about it. And it gives, say that cancer is not contagious. Most survivors go on to live normal or near normal lifespan. Some cancers have a risk of recurrence, but this varies widely against cancer types, stage and treatment response. And regular follow-ups are common and usually manageable. ChatGPT 5 minutes back.
Thank you, sir, for approving that. But it's like my experience is 30 years and so many cases I have seen. So I think, yes, there's no harm in marrying any survivor. Thank you.